Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. In this video, we're going to be looking at treatment options for plantar fasciitis. If you want more information on the presentation of the condition and the diagnosis, go back and watch the previous video, which I will link in the description here. Now, these first two exercises are essentially just forms of self-manual therapy. In one case, you have a foot roller under the foot, which is essentially just a small foam roller. And then down here, you have a frozen water bottle, which you can easily make at home. And you're essentially just rolling your foot over the foot roller or frozen water bottle, back and forth, back and forth. And as trivial as it might be, I'll show you a video of this in just a minute, but before we do that, let's discuss an analogy that kind of explains how this technique works. So if you've ever made homemade pizza, I mean completely homemade, dough is made from scratch, you end up with this big ball of dough and you have to flatten it out and kind of lengthen it so it forms into the shape of a crust. And one way you can do that is with a rolling pin, right? Now, in plantar fasciitis, the plantar fascia is irritated and painful, and one of the reasons for that is that over time it can become chronically shortened and tight. And so if you imagine the plantar fascia in your foot as the big ball of dough and the foot roller or frozen water bottle as the rolling pin, you're essentially just rolling out that plantar fascia, and over time it will become less tight, it will become looser, and it will become less painful. Now, with both of these techniques, the pressure you're exerting might cause some mild discomfort relative to the baseline level of pain, but it should not substantially increase pain. If it does, you're doing it too hard. Now, both of these techniques, as we've just talked about, are forms of self-manual therapy. But using the frozen water bottle additionally can help reduce inflammation. Plantar fasciitis is an itis, so there is associated inflammation. So the cold here, in addition to the manual therapy, can help reduce that inflammation. Now, regardless of which one of these two techniques you're using, you're just rolling your foot back and forth over the object, whether it's the foot roller or the frozen water bottle. Now, right here in the video, you see my MTP joints are relatively in neutral. Okay? So this form of the exercise is going to be a little bit less intense. Now here, I'm going to actively extend my toes at the MTP joint and hold that. What I'm essentially doing is activating the windlass mechanism. So let me pause right here. Remember the windlass mechanism from the previous video. It actually puts tension or a stretch on the plantar fascia. So if somebody is really good at tolerating the first form of this exercise, you can progress it by having them actively extend those toes at the MTP joint. Because not only would you be getting a little bit of manual therapy and a little bit of cryotherapy, but it also gives a little bit of stretch of that plantar fascia. That being said, this is a more intense form of the exercise, so you'll want to start with the original form that we saw in the first half of this video. But this is certainly a plausible progression. So as we just mentioned, the windlass mechanism gives us an additional stretch of the plantar fascia. That being said, an obvious choice for an exercise would be a windlass stretch, which you see right here. This is going to give us a stretch of the plantar fascia or plantar aponeurosis, and it can be done in standing or sitting, although I'm just going to show you the standing version. The basic idea is you're just going to brace the toes into extension against a static object. Here they're using a yoga block, probably because it's a little bit softer, although you can do it directly against a wall or a static piece of furniture, like you'll see right here. So there I'm just bracing my toes into extension against a piece of furniture. Now, word of warning here. Even for somebody without plantar fasciitis, this is going to be a pretty intense stretch. So imagine how it's going to be for somebody with plantar fasciitis. That being said, you want to make sure that when you educate somebody on this, or if you're doing it yourself, ease into this movement, because it can ramp up pain in the plantar fascia pretty quickly. So you want to make sure that you're doing it very easy at first and slowly move into it to kind of test the waters. Again, the pressure you're exerting can cause some mild discomfort, but it should not substantially increase pain. And with this windlass stretch, you want to hold it anywhere between 30 and 60 seconds because it is a stretch. So if this version of the windlass stretch is a little bit too intense, you can easily regress it into this, Basically, you'll have the foot up on some kind of object, whether it's a chair or a small piece of furniture, and then you'll reach down and loop the hand underneath the toes and basically just pull them into extension. The benefit of this form of the exercise is that you can better control how much extension and therefore stretch the plantar fascia that you're getting because you're using your hand instead of your entire body weight. And so obviously this form of the exercise you can make less intense if the person's having trouble tolerating the first form of it. Okay? As long as you're getting extension there at the MTP joints, you're still getting a stretch of the plantar fascia. Again, you don't want to cause any substantial pain with this, so if you are, you need to back off. And again, hold it for 30 to 60 seconds. Finally, we're going to look at a progression of the windlass stretch. So look at this picture right here. The front foot is just there for support. We're not getting any stretch in that foot. It's the rear foot right here that we're getting the stretch in. And we're getting two stretches simultaneously. One is of the plantar fascia. To do that, we need to brace the toes against something into MTP extension. Here the toes are sitting over a small dumbbell. That's certainly fine. I'll show you over here braced against this freezer. And the second stretch is of the triceps suri, so basically the gastrocnemius and soleus. And so because the ankle's in dorsiflexion, we're getting that stretch of the gastroc and soleus. Here's another look at this stretch. I'm going to be stretching my right plantar fascia and therefore also the right triceps suri, so the left leg is going to come out in front just for support. So the right toes are going to be braced into extension against that freezer at the MTP joints. And then I'm just going to lean forward to get more into ankle dorsiflexion here. Plantar fascia stretch due to the toe extension and a gastroc stretch here. I can make this more intense by bringing the left leg even further forward and then leaning further into the stretch to get more dorsiflexion in that right foot. I can make this even more intense by using my quad muscle to actively straighten the knee, because remember, that's another way I can further stretch the gastroc. And I'm going to hold this stretch anywhere between 30 and 60 seconds. Remember that the pressure you're exerting here can cause some mild discomfort, but it should not substantially increase pain, whether that be in the plantar fascia or the Achilles tendon, where the gastroc and soleus insert into the calcaneus. So hopefully this video gave you some good treatment options for treating plantar fasciitis. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.